So today's a special edition of the signalsaz.com podcast. And today we've got Dr. Shane Monnett, almost spelled like the painter, to talk to us about a recent milestone that Dignity Health has reached in robotics and surgery, I believe, in medicine. So tell me a little bit about it. You were jokingly saying you got Monnett working with Vinci. What's going on over there?
Well, starting this year, Dignity obtained one of the Vinci robot machines, and they obtained me from Charleston, West Virginia.
Okay.
I grew up in Wickenburg, and it's nice to be back in Arizona, back kind of home. Dad had a stroke a couple years ago, so we moved out here to be closer to him and closer to cousins and aunts and uncles and everything. Anyway, Dignity wanted to kind of join the cutting edge of medical, surgical experience for patients and treatment for patients. And so they got the Da Vinci robot and hired me kind of simultaneously. And that was in February. And since then, the team at Dignity has kind of pulled together all the nurses, administrators, all the staff. And we started doing surgeries in March with the robot. And just this past week, we passed 100 cases that we've done robotically. And, praise God, they've all been good. So
fantastic.
Good
so I'm
outcomes.
assuming there's a very specific type of surgery, or can you get into those types of details, get people an idea of where you guys are going with this?
Sure. The surgeries that I do are general surgery, so kind of the gastrointestinal system. So we've done a number of colon cancer surgeries, rectal cancer surgeries, bowel obstruction surgeries, hernias. Those are the main ones that I've done here. Dignity's moving towards, they've also had some urology cases done here. The robot has been really instrumental in prostatectomy, for instance, or partial nephrectomies or nephrectomies. And those are for urology surgeons. Okay. They do those. Also, they're moving towards OBGYN cases, so hysterectomies for a little more complex cases, larger uterus removals or multivisceral cases. So if you had a patient with a colon mass and a uterus mass or something, then we can do a combination case with the robot.
So let's talk about what are the advantages. There's obviously some advantages and why medicine is starting to adopt this. Can you go into some of those?
The robot cases take a lot of the fatigue away from the surgeon as far as the case. So if you're going to do a case laparoscopic, for instance, to take the colon out, you might take, 3 hours or, 2 hours, but you're standing there contorting your body to position yourself.
Or just awkward, difficult positions. Yeah.
So you might only do 2 of those more, contorting cases a day. And the way that the robot is, it allows you to be in a position of comfort as a surgeon so that you can operate kind of all day long. And, it's more like playing a video game, a little bit more enjoyable. And there's clutches on the controls where I can clutch my arms into a position of comfort. And as I'm working deeper into the pelvis, for instance, I clutch the arms and bring my arms back closer to myself where I can do some more fine-tune dissection. Other things are the optics of the robot are a lot better than the traditional laparoscopic optics. So there's 2 cameras and they give you binocular vision. And so you have a little more depth perception. or you have depth
Right.
perception instead of just monocular camera. And then kind of the detail is a little bit more, is just better. And so I can see vessels that are like a hair breadth and kind of have a lot less blood loss. So advantages are as far as the ergonomics of the surgeon being able to do more cases. And then the blood loss in research has been shown to be less with robotics than like conventional surgery. And in experience seems to be less than laparoscopic, at least.
And that was already pretty decent as an experience, right? Compared to even before that.
Correct.
Right. This is kind of that next leap. It feels like after laparoscopic. Is
Affirmative.
Correct?
Mm-hmm.
Right.
So that's like this is the next generation. It's been available for, 20 years plus, but it's kind of nice that Dignity's kind of finally caught up with more modern methods. And so
it's been around a while. I think that's clear, important to make clear to listeners. Is
affirmative.
This isn't on some type of beta trial.
Right.
It's brand new. This has been around 2 decades.
Yep.
And I'm guessing with AI and better computers is probably even better than it was even 5 years ago.
Mm-hmm. And each generation of machine is, like you said, getting better. So they're coming out with another machine that they've talked about putting in the hospital now that we've done, proven that we can do it. This machine will have tactile feedback. So basically the machine will feel like tissue when I'm
pushing
moving.
You go something, it'll push back a little bit.
And it'll feel softer things will feel softer and more dense things are denser. And that's important for cancer surgery, especially like I can only tell so much by looking at the tissue, how it behaves, but actually being able to palpate it is really important.
So ergonomics, vision,
Mm-hmm.
You just went into that tactile issue,
Mm-hmm.
new ones coming out. I'm assuming that in addition to those things, maybe this isn't the tactile part, but the precision of movement and because we all might have very still hands as surgeons, but we're still human. We're not perfect. I'm assuming that those robotics have very precise movements.
It kind of takes out some of the tremulousness that is just natural to.
That's a better word than shaky.
Right.
For a surgeon.
Being human,
Right.
But it's also, you've got to have that human instinct to be able to kind of take,
Sure.
you're in control at all times. It's more of like a remote control. There's not, there's not a initiate gallbladder surgery button or anything like that. It's kind of like more like a tractor with very fine, detailed
You're a specialized
control.
Systems manager or director.
Right.
Right.
And you're driving literally, and you can change the aspect ratios or like how far, if my hand moves an inch, how is my hand going to move an inch and the robot's is a 1-to-1 ratio, or you can change the gears to be like a 1-to-3. And so you move your hand even ever so slightly, and the robot hand is going to move 1/3 of that distance. So then you have a little bit more
safer
fine-tuning
play in there, right?
Correct. And you have 3 arms with the robot. So I can shift with my foot pedal. I shift to like I have 2 left arms.
Okay.
And so I can bump that shifter and I can use the 3rd arm to grab and elevate the colon, for instance, and then use the other arm to grab a blood vessel. And it's just a lot smoother because when you're doing laparoscopic, it depends on 2 practitioners, or surgeon and a assistant, who are both very perfect in their movements. But let's say your assistant is sick or something, or they can't come because they're helping with another case. Well, this way I can do pretty complex cases just by myself as far as driving.
Right.
It is necessary to have the team on board for like switching arms out and things like that. Because if you're going to transect the bowel with a stapler, you'll need to switch out for a stapler.
I see. So you have specialized arms for different jobs.
Correct. Mm-hmm.
Okay.
But you use the same 3 or 4 little portholes, these little incisions that are 8 millimeters. So, somewhere around as wide as a pen or pencil.
Mm-hmm.
And so then the person comes away with, 8-10 inches of colon removed or inguinal hernia or whatever fixed, and they come away with just very small incisions. You do have to have an incision big enough to remove the tumor. Right. So at the end of the case, usually is like you make an 1.5 inch incision to just remove the tumor or whatever.
So a part of the result of the robotics technology is what I'm hearing is also better healthcare in the terms like, since we're relying on less people per se, we're not subject to all these people's schedules. You said, somebody gets sick, or we have more specialists doing more work. We're not dependent upon so many human schedules. It's kind of sounds like that. I know you have your anesthesiologist,
right.
You have your nurses, and you have your surgeon, and I'm sure you have a lot of people in the room.
I guess it optimizes your ability to kind of make an impact when somebody needs to be moved around or something, so they can help somebody else.
Right.
And then another benefit is the length of stay in the hospital. Definitely. Right. So, like for instance, just this 6 months, we have done a number of open emergency, somebody's got a perforated colon or whatever, and you got to make almost a 1-foot-long incision. Those people have a tremendous amount of pain, and the pain control kind of holds them in the hospital.
Right.
So they're there for 7 to 14 days or something. But when you do the robotic cases, they tend to be home like in 2 days. So did a
difference.
Rectal tumor yesterday, and that guy's home today.
That's the big difference.
And he took a Tylenol.
Wow.
And the pain control is definitely the big difference. And then the blood loss is like tablespoons instead of, half a cup or a cup or something.
So in medical school, was this something that was around for you, and was this something you really wanted to pursue?
Yeah. When I was a medical student, I actually did medical school at AT Still University in Mesa. And then some of my rotations were up here, including Flagstaff Medical Center and in Prescott here. And Flagstaff had the robot at the time. And I was really intrigued by it. It seemed, like space age type technology that was really impressive. And I liked seeing the balance of using the robot when it needs to be used and then doing open surgeries, in those times, and kind of seeing that wisdom of judgment, and wanted to be like that. And I actually got to do some rotations as a student here, and kind of through the grapevine heard that there was kind of a need to get into that generation. And I didn't really think about it until I was graduated and I was done with residency, and I was in West Virginia for 4.5 years and helping teach the WVU students there. And then Dad had a stroke a couple of years ago, and we were looking at coming back out west. I didn't really want to come to Phoenix because it's too hot for me.
It's a little hot.
And coming from West Virginia, it's kind of like a jungle and greener. And
Right.
I kind of wanted to be somewhere where there's pine trees, we
Somewhere
can get
between.
close. And this was the perfect spot. And an opportunity opened up in the fall,
Awesome.
and we signed on.
So you mentioned that these devices have been around for almost 2 decades, 20 years. Between then and now, what has been the growth in the utility or the use of these things that we see in medicine now?
Used to be like your bowel surgeries or, GI surgeries like I'm doing, probably about maybe 5% in the 2000s were being done with the robot.
Right.
Now it's like 95%.
Wow.
So it's
I didn't know it was
completely,
that high.
it's completely shifted.
Do we have data on the benefits of it, meaning we're seeing higher survival rates? Or I know we probably have data on recovery time. Do we have any numbers like that?
The recovery time is definitely better. Blood loss is definitely better. Survival rates are same.
Yeah, because it's
the same
cancer's
surgery.
cancer, right?
Correct.
Let's just be frank about it.
So if somebody's afraid to, let's say somebody says, well, my surgeon only does open surgery. Don't let it hold you back from getting taken care of. If you're in another community, just get it done, because it's going to be just as good in the long run. It's just, can you get home a little bit quicker and kind of get back to your activities?
Recover and heal up quicker at home as well, right?
Affirmative. Yep.
Interesting. That's a pretty big step. At how many? So, are we looking at more machines coming to the Dignity system here in Central Arizona?
There's talks about starting, putting a unit over on the Prescott Valley Hospital for the OBGYN team, especially because they've already hired one OBGYN that's coming in October time, and she's really well trained on the robot. And then I have 2 more partners coming to Prescott that are trained in the robot. So the thought is we can take one of the machines, put it over here in Prescott Valley, and then have another machine in Prescott. And most hospitals actually have a few of them because the demand is so high. Like, for instance, my practice in this town was gauged to be about maybe half as much as I'm doing. I'm doing like twice as much, and we're booked out to like January.
Wow.
With cases already and people in clinic. And, I apologize if it's taking longer than expected to come and see us, because basically the doors are just full.
That's across the board. I mean, I just went through an experience with a family member, and it's just the demand. It's the system. I don't think it's any one particular facility.
And I think these towns, Prescott and Prescott Valley, they could use probably about 3 times as many surgeons.
Well, we need 3 times as many houses.
Affirmative.
That's a whole other political issue we won't get into.
Yep.
Dr. Monnett from Dignity Health. Are you at the Prescott or Prescott Valley campus?
Both.
You go, but you just wherever they need
Wherever
you.
they need me.
Well, thanks for coming in. We appreciate it. Congrats on the 100th.
Yes, sir.
It's a pretty big milestone, and hopefully we get more robots.
Yes, sir. Thank you.
All right. Have a good day.
Thank you. God bless.